Hello, I'm Susan Racher, Board Chair of NAMI Miami, our local affiliate serving the Keys and Miami-Dade, affiliate of the National Alliance on Mental Illness. And I am really happy to welcome you to May Mental Health Month, which is why I'm wearing green. Did you know that Mental Health Month, May Mental Health Awareness Month, was started in 1949 as the U.S. was recuperating from World War II. So this is the 75th anniversary of May Mental Health Month, and that is significant. Also significant is the signature event for Mental Health Month that we will talk about today, the Walk for Mental Health Awareness on May 18th at Zoo Miami. NAMI's North Star is to remove stigma from the conversation about mental health and to help people understand when, how, and where to access mental health support and resources. And we will talk about the walk today, as well as the answers to when, how, and where to access mental health resources. And joining me today are two wonderful guests who will help us delve into answers to these questions. Dr. Anna Viamonte-Rose, welcome and thank you for being here.
My pleasure.
Thank you. Is a professor of medical education at FIU. She broke many barriers as the first Surgeon General of the state of Florida and the first woman and the first Cuban American to head the state of Florida Department of Health, which is a significant milestone in our Florida history. Dr. Viamonte-Rose is also vice chair of the Camillus House, on the executive board of the American Heart Association. She is formerly was the first chief wellness officer at Baptist Health, and is on the board of the American Hospital Association, and most proudly is on the board of NAMI Miami, and we treasure her. Welcome.
Thank you. Thank you so much.
Kate Edelson is NAMI Miami's Director of Events and Fundraising. Kate is in charge of our walk and will be telling you about the walk and about her amazing history of working with NAMI Miami with our youth programs and establishing NAMI's walk as one of the largest walks in the United States. Welcome, Kate.
Thank you, Susan.
Without further ado, tell us about the walk.
My pleasure.
And why is it important, and why do our viewers need to know about it?
So, like you mentioned, the Walk for Mental Health Awareness is going to be part of Mental Health Awareness Month. It's taking place on May 18th at Zoo Miami, which we are so excited to do because the zoo is such a fun venue. Mm-hmm. Not only will we be all gathering together in large groups, we anticipate between 2,000 and 3,000 folks. I found out today that we broke our participation record of over 2,000 people, and we still have at least 8 days before the walk, so that's really exciting.
So it's not too late to register at all?
No, not at all. So anyone who wants to register can register all the way up to May 18th at NAMIWalks.org/Miami. It is free to register, so anyone can attend. And at the zoo, we will be walking and seeing all of the animals on the day of. So not only will we be gathering for an amazing cause and to celebrate mental health awareness, but we will also be seeing all the fun animals that are at the zoo, as well as the zoo mascots on the day of too.
Amazing. I joined you last week to walk the course, and oh my gosh, you walk into the gates and you see the elephants. I mean, it's just so amazing. So Kate, who is going to be there in terms of sponsors, resources, as well as walk teams?
Absolutely. So it's an amazing gathering because it draws people from all over the place. And as far down as the Keys, even up in Broward, people are coming to our walk. And so we'll have a lot of different community partners as well as sponsors, such as Bank of America, the Zoo Foundation, Karuna Therapeutics, and a lot of other great resources, including, like we mentioned earlier, the Mobile Response Unit for Miami-Dade from the West Care Village South will be in attendance too. The fire truck will be there from the Miami-Dade Fire Rescue Department, and Miami-Dade Public Schools is going to be coming in mass. They have a special shirt that they designed just for the occasion, just for mental health awareness. So all the students from Miami-Dade Public Schools will be wearing their matching shirts, and we're also going to have a lot of fun things there too. So on top of the fire truck and over 60 community partners and sponsors gathering in one place to share key resources, we will also be having a sparkle station from Sparkled by Sharona, who will be providing hair tinsel and face sparkles for anyone who wants to come. And we'll have a Messages of Hope banner. So anyone who wants to share a little message with other people to let them know, you know, to keep the hope, to keep trying, because sometimes, even though this is a celebration of mental health awareness, it can be very difficult, as we all know. So there'll be a messages board where we can remember anyone that has passed away and also write inspiring messages to everyone on a large banner for all to see. So there'll be a lot of different ways to engage with mental health awareness, whether you're just there to have a fun time and walk in one place with thousands of other mental health advocates, or you want to connect with really important resources. I know several of our sponsors will be bringing their clinical staff, and will provide opportunities to ask about their clinical resources, as well as anything else you might want to know about what mental health resources are available in our community of Miami-Dade and the Keys.
Thank you, Kate. And without further ado, we are going to show a brief film of our walk last year so that our viewers can see the energy, the resource and access, and the fact that there is no better way to combat stigma, which we'll talk about next, than attending a walk with people who are proudly talking about their mental health experiences and advocating for mental health for all. You can put up the flyer. It was a thrilling and exciting year last year at Lone Depot Stadium. This year, we've taken it to the next level with the zoo. So Kate, walk us through registration, and on the screen is a flyer that will guide our viewers into registering.
So anyone can register for the walk for free. This is an event that is meant to be accessible to the entire community. And so anyone can register at NAMIWalks.org/Miami. And that's where you can find information on where to go on walk day, the timing of our event, and any rules that apply. So for instance, children of all ages are welcome to the zoo. We just ask that you register unless they are under the age of 2, and they'll receive a wristband on walk day that will allow them to have access to the zoo for the entire day.
Wow.
So anybody who attends our event and gets a wristband will have access to the zoo all day long. So you can walk as part of our event, come back, be part of our vendor village, talk to our sponsors, and then go back into the zoo. So it's really a fun opportunity to, again, engage in Mental Health Awareness Month, and then also see some really cool animals. Unfortunately, the only animals allowed at the zoo will be the animals at the zoo, so we'll have to leave our furry friends home, even service dogs this year. But there's a lot to see that day, so whether you're enjoying the animals at the zoo or the fun mascots that will be in attendance, you're going to see some cool things that day.
Excellent. And, there are 3 pillars to the walk. So we talked about access to resources. Every provider will be here.
Mm-hmm.
Will be at the walk. The second is stigma. And I'd like to address that now. Why is managing stigma, why is the issue of stigma in this day and age in 2024 still such a barrier? And how can we create better awareness? Dr. Viamonte.
Thank you very much. You're absolutely right. It is a huge issue, but organizations like NAMI and discussions such as this is what helps us bring these issues forward. And I dare say that every one of us has either a family member, a close friend, a coworker that has suffered at some point through mental health issues. And it's so important to be honest and to have the opportunity to speak about this openly and to know, very importantly, that we're not alone. That you're not alone, and that there are resources out there. There are many, many people that have struggled with these same challenges. And an organization such as NAMI and an event such as the Walk will help emphasize that you're not alone, that there are many, many people that have gone through these circumstances, and that there are many resources out there to help you.
There's still so much shame, self-shame.
Absolutely.
And then shame about what other people feel.
Absolutely.
I was having lunch a while back with a former colleague and just talked about the walk and learned how his family had been bottling up a mental health challenge of their loved one.
Absolutely. I think that regardless of your age, your ethnicity, your religious background, whatever, what will it say about me as a person? What will it say about me as a parent, as a caregiver, as what will people think of our family? It's something that's so difficult to overcome. But that's why the more we talk about it and the more you realize that every one of us has experienced these challenges and that you're not alone is so very important. I think in the medical field, which I'm part of, for someone to admit that they have a mental health challenge is extremely difficult. What will it say to my patients? What will my coworkers think of me? I'm not as good as I should be, or there's something deficient in my care if I admit to something like this. And we just have to break through that. And our leaders have to be the ones that set that tone and be the role models to speak openly about these challenges. And I frankly joined NAMI because of you and your authenticity and your honesty about your own family situation and your own challenges. And I realized, oh my gosh, that's what we need more of. We need to be able to openly speak about it. And as a caregiver to somebody, in my case, it was my mother, who had these challenges all her life, I always felt that it was so important to be open about it and to discuss it and to discuss the challenges of being a caretaker, that I might not have an illness, but I certainly was struggling with caring for her as well. So you're not alone, and organizations like you prove that.
Well, thank you. And, we are experiencing in this country and around the world an epidemic of loneliness, and we've talked about that.
Yes.
And connection in general is so important. The feeling that you have when you're part of a greater whole.
Absolutely.
But for those struggling with a mental health condition that normally strikes in young adulthood or later in life when there are significant changes, it's all the more important to connect with each other as we're caregivers, as well as individuals with lived experience. And everybody at NAMI has that lived experience, is not a clinician. We all have been there. And clinically, mental health conditions are treatable, aren't they?
Absolutely. And there are many, many very successful, accomplished people that have been effectively and successfully treated and live with an illness, just like you would with diabetes or arthritis or with anything else. And so there are treatments. And I think something that NAMI offers is these support groups that I think, again, so that you feel that you're not alone, that you do have a social support system a safety net, so to speak, that's so important. And like you were saying, and I think we were talking about it over lunch, the emphasis on social networking a lot of times has isolated folks and not allowed them to mingle and to be able to share experiences in person with others. And an experience like this walk, as well as an organization like NAMI, provides that.
Well, and Kate, before Kate became a walk manager, was instrumental in building our youth program called Ending the Silence. And that program speaks to youth about mental health and the necessity to be open about it. And Kate, as you reflect on your experience with Ending the Silence and mentoring Ending the Silence facilitators and training them, what can we derive for our youth from that experience?
Well, one of my favorite things about Ending the Silence is just the empowerment of the entire program for those receiving it and for those giving it. We talk a lot about the great things that NAMI does, but one of the most key things for me is taking what has been a dark experience in many ways, some of the more difficult parts of my life, struggling with my mental health and watching the people I care about struggle with theirs, and using that experience to help others better understand how they can take care of themselves. And not only that, but give them the opportunity to do something and know what resource they can go to when something like that arises.
Absolutely.
And that was really my favorite part, was not only talking to middle school and high school age children, addressing the age group where I was at when I was not doing so well, but then helping people who have been there and who are sort of ready to use that experience and training them to be like, you can take this experience, which otherwise might have just been this dark period that you might have been scared to talk about, and transforming it into something else. And that is the power of NAMI, and that's the power of the walk, is that we are not going to stay in this dark place alone. We are going to gather in one place together and show that even though we have these experiences, that's just part of life, and we shouldn't be ashamed of them. People oftentimes may see it as a personal failure, and that's why we don't talk about it, like you were saying. But it's not. It's something that most of us experience one way or another, even if it's temporary, even if it's just a dark time. And we can really find connection by being very open about it. And so I think that Ending the Silence is, a parallel to the walk in many ways, because we have that opportunity. And not only, are we doing that for middle school and high school age students, but we have our campuses in college too, our NAMI on Campus program, where college students can go on beyond, after Ending the Silence, to then sort of come full circle and be able to participate as teachers as well, and then to bring that to college campuses and participate in mental health awareness, and then even go on to be part of our young adult peer group as well. So I really think that the ability to have this transformation of something that is dark or scary or difficult to talk about and bringing it to the light is such a big part of what we do. And it's really beautiful to see people go through that change of thinking sort of negatively about their experience, have it weigh them down, and then turn it into something that actually lifts other people up.
I remember my own feeling when I was able to talk about it, and what a relief it was. And how important to our family and to our son's recovery to be able to talk openly about it. He saw that we were not shamed, so he stopped being shamed, and it really lifted a huge burden. So we've talked about stigma, and we've talked about access to resources. I would be remiss, probably fired, if I didn't talk about the third pillar, which is that everything that NAMI does is free. And how do we do that? We do that by raising money at the walk. When you sign up for a NAMI program, NAMI education class, support group, you attend our suicide intervention programs, whatever we do, our Ending the Silence programs are free to everyone. We do that because of support from wonderful organizations and the walk. So last year, our walk raised funds for us to expand outreach into underserved communities. We reached 10,000 students in Ending the Silence. We expanded our suicide intervention programs, and we expanded our warm line to be answered all day in 4 languages by dedicated people, as well as launching what we call and expanding our peer mentor programs, which are one-on-one coaching. So I urge everybody watching this to go to NAMIWalks.org/Miami to sign up, to donate. If you have a friend walking, look for their team or their name and support them. If you don't, sign up yourself or support the organization in general. This is important because one of the things we do is help people understand when to get help and hopefully intervene early. How important is early intervention in mental health? We know it's important in cancer. We know it's important in endocrine problems. We know it's important in any chronic illness. How important is it to mental health?
Like you said, it's important in every illness to be preventive, but also to be timely in accessing care. And it reminds me a little bit of when someone is in pain and you tell them, don't wait until the pain is so overwhelming that the medication will take that much longer to work. Mm-hmm. Take it early and seek care early. Don't wait until you're so down and it's just that much more difficult to make that call or to ask for help. Do it early, understanding that everyone goes through these moments and these dark periods. We all do. Mm-hmm. And so ask for help. Ask for help. You're not bothering anyone. You're not preventing anyone from doing anything. You ask for help. People want to be there for you, and they will direct you as to how best to seek that help. And the earlier you intervene, the easier it is to sort of come back out of something. Absolutely. So ask for help.
And in addition to darkness, are there a couple of other clinical symptoms that you look at?
I think your sleeping patterns, your eating habits, you're maybe lacking in wanting to exercise or get out, your lack of socialization. All those things are sort of indicators.
Warning signs.
So be aware of that. And be honest with those closest to you and say, do you see a difference? And if, please let me know if you see a difference in my own behavior, my own habits. Mm-hmm. But intervene early, ask for help early.
And reach out. And for those who have people reaching out to them, listen.
Exactly.
Listen. I think I read a study from Pew last year that something like 59% of people would not tell a friend or a family member they were having a mental health condition.
Right. And we're embarrassed. We don't want to, bother anybody. Everyone has their own problems and their own issues. And here I am going to then add to that. But ask for help. We're all there. We need to be there for each other.
Right. Thank you. And NAMI is there for you as well. Would like to share a few resources before we conclude. We've had some major, wonderful developments in our community. So first of all, you need help, call NAMI, 305-665-2540. Come to the walk next week. We will have our entire NAMI team there, our board, as well as our provider partners. We have 988, which is the mental health and suicide crisis line answered by Jewish Community Services. It is a wonderful, wonderful resource. It is free. We also have mobile response teams so that if you or a loved one is having a mental health crisis, you could call 1-800-HELP-YOU and speak to at least a master's level or above clinician, get advice. They will come to your house, your school, your place of employment to help you if needed. Thriving Mind South Florida is our managing entity. It covers all of the mental health and substance use provider network from Miami-Dade and Monroe. thrivingmind.org has a bunch of resources. Thriving Mind is supported by the state of Florida, and is just a wonderful, wonderful funder, resource, and curator of a provider network. Those are the main ones: 988, Mobile Response Teams, NAMI, Thriving Mind, and there's a new development as of May 1st in celebration of Mental Health Month called The Living Room. It's at New Horizons on Northwest 36th Street. It is truly a living room where if you are feeling unwell, you can go to the living room. You could meet with mental health peers who are trained. You could also be evaluated by a clinical team, and if necessary, given clinical help right then and there. It's a comfortable, beautiful, engaging environment. It's called The Living Room at New Horizons. It's funded by Thriving Mind. So we are building and have a nice system of resources. All of these organizations will be at the walk next week. So I'd like to put up the walk. And Kate, let's just conclude with a couple of thoughts about the walk, and then we'll turn to Anna and then conclude.
Absolutely. So just a little announcement. I recently learned that we are a little over 80% of the way to our fundraising goal, which is $380,000. So a huge thank you to everyone who has participated thus far and made all of this possible. We are 8 days away, so there's still some time. And then I just wanted to remind everyone that the walk will be at 8 a.m. at Zoo Miami, Saturday, May 18th. There is a little bit of time between 8 and 8:30 where people can register, and then we will have our opening ceremony. There'll be a performance from an amazing violinist, as well as a performance from a steel drum band from Miami-Dade Public Schools. And so we're having a lot of fun things there. We hope to see you, and this is going to be a phenomenal event. Someone said to me earlier, just imagine that you're at an event with a little over 2,000 of your closest friends. And I think it's going to feel just like that. It's going to be so incredible, and to take an experience that, like we said, can sometimes be so isolating and make you feel so alone. I think it will be impossible to feel that mental health is making you feel alone on May 18th. And I look very much forward to experiencing that with all of you.
Thank you, Kate. And Anna Viamonte Ross, we are so blessed to have you not only on the NAMI board, but in our community, given your dedication to mental health, to medicine, and to the most vulnerable. And
thank you. Thank you. I'm the one who's blessed and to be part of this. But I wanted to add also, there's a dearth, as we've discussed many times, of mental health providers in the community, navigating our insurances, really lacking in parity between our physical and our mental health as far as coverage and it can become very onerous to find a good provider. So take advantage of organizations like NAMI that will help you and direct you and will be supportive of what you need.
Thank you. And I think I'm thinking of a fourth pillar now, which is advocacy, and all those making those large decisions about our mental health system when they see the size of a walk like ours, which is one of the largest in the country now. Thank you, Kate. And thank you, NAMI team. Go NAMIWalks. That message hopefully will resonate. So thank you both.
Thank you.
For this afternoon, and I look forward to seeing you and seeing all of you out there on May 18th at the zoo.
Thank you.
Can't wait.